The doctor ordered a rule-out pseudoaneurysm on the patient in room 413. Now what? You've seen this demonstrated as a student, but you have never performed this examination on the job. How to diagnose a pseudoaneurysm. Upon completion of this module, you will be able to define a pseudoaneurysm, list causes of pseudoaneurysms, identify sonographic findings as well as treatment options, and be able to demonstrate the required images needed to diagnose a pseudoaneurysm. So what is a pseudoaneurysm? It's a collection of blood that forms between the two outer layers of an artery, the muscularis and the adventitia. Some causes of pseudoaneurysms include trauma, arterial puncture, infection, and insufficient manual compression after a procedure. Sonographic findings associated with pseudoaneurysms include a tract or neck that connects the artery with the pseudoaneurysm. So here is your native artery, and this is the neck indicated by the red arrow, and you can see it's traveling up into this superior area where you see the red and blue. Some color and duplex findings you will also see in a pseudoaneurysm are a to and fro pattern. So this is a high velocity jet that enters the neck from the artery in systole and then has a reversal of flow back into the artery during diastole. So here you can see there is flow above and below the baseline. Some additional color and duplex findings include a swirling, colorful collection. So you will see usually blue-red in the pseudoaneurysm itself. We call that the yin-yang or the Pepsi-Cola sign. Treatment options include, if it's really small, they might just have conservative treatment. They might just watch it and see if it enlarges. They can also go in and surgically repair a pseudoaneurysm, or they can manually compress it with the ultrasound transducer. Or more commonly used these days, they do a thrombin injection, which is what you see here. So here's the needle going in where the red arrow is, and the radiologist is injecting thrombin into the actual pseudoaneurysm, which will cause it to clot off. So some summary of the key points. Obviously, you want to attain a thorough patient history. You want to find your landmarks and go back to what you know. So if you get disoriented, go back to what you know, find your common femoral artery and vein, image the vessels and the pathology in both planes, and look for a neck. That's very important. You have to have a neck to actually feed the pseudoaneurysm, and also obtain color and Doppler images and record velocities. In the following video, it will demonstrate how to interrogate the vascular associated to diagnose a pseudoaneurysm.